My name is Georgia Powell. I am a health and wellness strategist. My work is to restore the health of our communities, both on a mental capacity as well as providing services for older adults aging in place. I am a gerontologist. I've had 20 years working with our corporate team in the corporate world, focusing on the health of our community, one of which is running the Connecticut Medicare Advantage Plan for the Connecticut state retirees, as well as a tobacco cessation program that is governed by CDC. I recently stepped down a year ago to create some suitable solutions that our state needs. One, around mental health awareness, education around that, and two is around providing our older adults with a space that they can live and can feel that they're protected, as well as be able to kind of sustain what are some of our outlook for improving the healthcare outcomes. So two of which was, I created Powell Consulting Services. I am a mental health instructor, so I train nationally, working with a lot of the providers here in Connecticut, working with caregivers of some of these said older adults to be able to recognize the early signs and symptoms of mental health and when to refer out for appropriate professional help. And so from this, I had to build that foundation so that I can support the venture of providing what we call residential care home for older adults wanting to age in place, taking the burden off of their family members and off of the system to lower the readmission rate when they're aging in place alone. So with that being said, Vashti Estates, given after my grandmother. About a year ago, I lost my grandmother who used to do this work. So I'm taking the baton from my grandmother and passing it forward. The state of Connecticut recognized her for her efforts in being able to retire from one of our affluent nursing homes here. But her passion was, never let me go back to one of those. I want to be able to stay within my community. After she retired, she restored the health of her community by going in and visiting a lot of our priority populations that may not have the income to do that. And so with that being said, I am just taking a baton and moving it forward, knowing how to build residents within our own community to support this growing need of a population. So this is my grandmother here. Our mission is for these residential care home is to provide the highest quality and innovative personalized care. Innovation is the piece that's missing, right? We have a lot of care systems that take care, but in order for us to meet the demand of where our older adults and that growth is going, we need some technology in place to be able to support that. And so when you get these residential care homes planted in these communities, right, it allows us to not spread thin our nurses and practitioners and all that our healthcare hospitals and so forth depends on. We're able to give these individuals a quality of life, reduce isolation and loneliness about being in their own home, and be able to provide all the activities of daily lifestyle in that same home in an environment where they can, coordinate and speak with those that are in that home. Our core mission is to create a cost-effective solution. I will show you how, right, based upon the comparables of what our current systems are, what does that look like for residential care home? This is the problem, right? People are living longer in the United States, right? They need caregivers, right? The need for caregivers will increase over time. We're behind the curve as to where we should be, right? Some of these people are our grandparents, our parents, our neighbors, right? And so that's the problem. The current numbers right now is 54.1 million that will get 65 and older, right, in 2002, and wants to live alone. That's the thing, right? 94.7 million, it's by 2026. How are we going to meet that growth? We can't depend on the long-term care solutions because not everyone could afford it. So with that being saying that, they want to live alone, but it's complex. It's very expensive and it's limited the care and the safety. That's where we're going to mesh good care with the technology, those two pillars, elevate the support that older adults can get. So we don't need to see our older adults living in their own home looking like this. So the solution, right? How do we solve for some of what we're seeing? Because it's hit mine. My grandmother lost, right? 92. She could have, lived for another 10 years. My grandfather is still in that model, 96, still aging. How do we give Connecticut that, right? Because everyone wants to move to Florida. Florida cannot keep everyone. So how do we create this for the state of Connecticut, right? So what we call is residential home care model. It's a 24-hour concept. Provide meals, custodial care, activities of daily life that's just taken care, right? Medication management, transportation, and being able to have a private or shared room, right? With that being said, I put, the slides were off here, but WellCare, I serve on the National Aging in Place Council as a co-chair, and our goal is being able to partner with folks that could support the need of our older adults in our community. And so WellCare is able to provide that technology, not just something that you wear, but are able to scan the room and determine if someone had a fall, right? How do we get alerted? If that person is not able to push the button, no one is going to be able to be notified. And so he is the co-chair of the chair for the National Aging in Place Council that I'm on. And so it's nice to kind of bring those elements as a technology within this model. This is what I would like for our older adults residents to look like. Have that experience, right? Reduce isolation and loneliness, but be able to live out their life as healthy as possible, lowers the readmission rate, and lowers the cost of healthcare over time for this critical population. So let's look at the competition. I don't say it's competition, but I have to be aware of our surrounding, right? I'm more so looking from a research standpoint as to what they're doing and how I could do in addition to really meet the needs, the gaps, right? And so we have Maple Leaf Manor also in Hartford. I like to bring into the Hartford demographic. So a lot of data tools that are able to kind of pinpoint in each town in Connecticut how much of these older adults are out there, right? So, and those are the towns that I really want to target because we know that that's where it is. Avery Heights, some of us know who they are, Gilmore Manor in Glastonbury. And so I want to prove this because you'll see a drop in every one of these towns. In Marlborough, by the river in Marlborough, are our new facility. So been just in conversations with the state of Connecticut because I want to know who these individuals are. I want to know their offerings. I want to know exactly what they're doing to improve as they open up. And so that's a lot of the research that I've been taking a look at. But what we can provide is, again, the data, the safety alert technology that we describe, not just a button, right? If you're having a heart attack, if you haven't been moving around in a while, your family needs to know that. And so they can get those alerts and engagements. I've been in the market for 20 plus years working with this as a gerontologist in the medical field. That's the line of work. Just finished my doctoral program this week so working on the dissertation just to solve for some of this, right? That's why I went back to school, because we need this. And then my community relationship. We can't do it without a community. We can't depend on the systems. We have to turn our communities into the solution that's going to help us get there. So let's look at some of the data, the comparative analysis around this model, right? This is where I'd like to be, right? For some of our priority populations that we're dealing with, they can't afford a nursing home facility. Those are the pricings, right? In-home care, it's nice, but it's just one. So this residential model, you have multiple individuals in the same home, right? And these are the costs. Still are able to be profitable, right? They're not going home for home delivering care. So you may see the uptick in prices right here. Let's tell you exactly what the future looks like to support some of the growth and the need for this. So as we take 10 years ahead, remember we're 10 years behind. Here I'm looking, 2021, right, data, to 2031. Let's look at where our community assisted facility 82. So you see the jump. In-home care still continues to get expensive, but look at this. Our priority, Black, Brown, those that are, I'm an immigrant here, my parents are, right? So we believe in staying in home, right? It's growing. There's no one going to be able to afford that. So this is where the model of a residential living facility comes into play. Still profitable, right? Because you have everyone in the same home and are able to kind of deliver a more intimate service. So these financials are a little off. I'm going to be honest. There's a fluke here, but so if I had started out in a home of 10 people, right? Just scaling my staff, right? My first year profit growth is about 400,000. Right? Second year is higher in the 400, but by the time I go to the fifth year, I'm over $1 million in profit at that point in time, right? Still scaling my staff, still scaling, adding, because you could never fill a house at once. But one house, our intent is to grow in each of these priority communities where we see that there's an uptick of older adults needing help that could support this model. Next slide. So let's look at it, right? This is the number of total Connecticut individuals, us, right? 25% of all of the Connecticut total population is 60 and over, right? So 1/4 of these individuals, where are we going to put them? There's healthcare, right? So my target is our consumers, those that are 60 and over, right? There may be those with disabilities that may need some additional assistance. Providers, hospitals, nursing homes, right? They may be my competition, but they can't house everyone, right? And so this is where the model is able to provide that support. Our community partners, state agencies, churches, right? Families, these are where a lot of those referrals are gonna come from. These are where managing the state of Connecticut Medicare Advantage plan, those are where I can afford this. These are the places that you can go to be able to pull some of these services in. And so those are going to be our partners for scaling, filling these homes, and being able to bill and follow that same model. So that's our target market. So our team, myself, right? I'm using, or I've built a team already to vet my idea. So they've been following me for about a year, using some retirees from Connecticut that would want to dedicate their time. My mom, she's at the age of retirement right now. My brother, who's an attorney, who are willing to take a lot of that, hardcore money items off the table. Next slide, please. So our team can still continue. Marketing is huge. Nice to keep a marketing. My uncle, who's a chef, right, been working at this place for so many years, willing. Of course, we need our tax accountant. Alana, a good friend of mine here, started here in Connecticut, sales and marketing. She is a beast, right? Willing to dedicate a lot of these resources that you would normally have to create a pillar for. And then, of course, next, I normally wouldn't show this, but I'm trying to show that our community is really the help meet. We can't always depend on funding, but these are great business folks of mine that have gone, we all went to UConn, majority of us went to UConn, and they're willing to give back. India D. Cordova, great in the fund development, right? Great friend of mine. When you talk about education, we can't just provide a service without an education. So these are where these people come in. Let's educate the care providers. There's going to be people that need that transition. We need folks to educate them. And so these are some advisory folks for me. Next slide. So again, the investment that we're looking right now, of course, Powell Consulting, me educating and partnering with organizations to be able to train, right? It does bring in some of that funding to kind of level set, but majority of it is going to take place in the residence. We need housing to support a lot of the programming that we want, right? Renovations, marketing, the staff is a little lower just because I know that I have folks that are willing to give over that first year to see it go off. And then, of course, the other bucket would be all the other things that I'm not considering right now. And so that's how that initial fund would be used of any sort. That's the mindset I have around it. So I would just say that the community needs your help, right? I stepped out of my corporate role very comfortable about a year ago because I know that I've seen a lot of deterioration from a research perspective, from managing some of these state, federal level programs. We need more, right? So my community is coming together to support, but we need funding to be able to provide that housing solution so that we can run these programs and start to kind of meet the needs of where we should be. Powell Health is really just education, consultant around that. And then that's my contact information. On Instagram is georgiapowell.health at Instagram. And so we're just looking for funding to be able to meet the needs of our community. Thank you.
Great presentation. So when you're thinking about kind of getting this physical residence up and running and providing support, I think, please correct me if I'm wrong, but there's an increasing nursing shortage in the state. Mm-hmm. How are you thinking about staffing, especially as to get to scale, to make sure you have the level of expertise that your clients deserve? Yeah,
so this model specifically deals with what we call non-skill, a lot of the non-skill care. These are individuals who live in their independent home, depend on individuals like yourself to say, hey, I need you to check on mom, I need you to check on dad, I may need to travel for a week, and they're left, just like that first photo, wondering when they're gonna get that other insight of someone checking in on them, right? And so it's non-skill care for a lot of these folks to be able to reduce exactly the readmission or admission to hospitals that we're seeing, because we're paying that bill no matter what. How could we solve? And so in this home, you not just have one person, but you have maybe a house of 10, 20, 21, and you have a very intimate model of folks still providing that, same care, right? And so that's again, thinking about the nurse shortages, the staff that we have, it cannot accommodate just, we're not moving from home to home, we're building into our community so that they can integrate together.
Got it, thank you.
Yeah, that was my question, actually. I wanted a visual of what the facility looked like, because I wasn't clear.
Yeah.
On the facility, like you said, how many units, how many rooms, were you building new construction? Were you identifying existing properties and renovating or retrofitting them? So my question was about the facility.
Yeah, so what we're doing now is actually looking for spaces. So what we're doing is going after those homes that is at least, 8 to 10 rooms to start out with, right? Homes that's already existing. And so what we would do is see if been dealing with the Department of Public Health, we're dealing with zoning and so forth. Can this current house or structure fit the needs of what we need to do to pass from our criteria to be approved? So a lot of the laws will change, I think, in March. They need an elevator in majority of these. So these are the things that we're trying to solve for right away. But you get that. But the next home, get it built out to spec that would house, more people.
Do you have the funding in place to secure those properties and do that build out, or are you still trying to raise funds?
We're trying to raise those funds right now. I've donated for myself, a lot of money, sold some asset to be able to pour into this business. A couple, and again, we have folks that are, if we need to hold fundraisers, that's what we will do. But, it's on the forefront. Thank you. Thank you, everyone.